Medical emergencies in the dental office, knowing how to prepare for unexpected events and being attentive for prevention. So I had to research 4 different types of medical emergencies, which are hypertension, hypertensive crisis, syncope, and angina pectoris. The first one I want to go over is hypertension. So what is hypertension? It is also known as high blood pressure and is one of the most common chronic cardiovascular conditions in the US. It actually affects at least 1 out of every 3 people in the United States. Blood pressure measurement is an important screening vital sign at dental visits. And I also want to go over the white coat versus chronic hypertension. So signs and symptoms. Most people with high blood pressure have no signs or symptoms, even if blood pressure readings reach dangerously high levels. A few people with high blood pressure may have headaches, shortness of breath, or nosebleeds, but these signs and symptoms aren't specifically and usually don't occur until high blood pressure has reached a severe or life-threatening stage. Therefore, taking vitals at the beginning of every dental appointment is important, or at least some offices, as I was researching, they at least take it, with every new patient, at least once a year, or if they know that someone has high blood pressure, they take it at every appointment. And so that is important because you want to know if this person usually has high blood pressure, or is it a white coat syndrome where they're just really nervous for that appointment, and that's why the blood pressure is high. So there's different stages in hypertension. There's stage 1 hypertension, where the systolic pressure is ranging from 130 to 139, or the diastolic pressure is ranging from 80 to 89. And then stage 2 hypertension would be a next level up, where the systolic pressure of 140 is of 140 or higher, or the diastolic pressure is 90 or higher. So what are the procedures for hypertension? So if it is stage 1 hypertension, you would retake the blood pressure after 5 minutes. It is good to take, in any case scenario, it's always good to take the blood pressure at least 2 to 3 times. So you would wait 5 minutes, retake the blood pressure. If it is still elevated, you would inform the patient of pre-hypertension status, and then you would recommend a primary care provider consult and encourage lifestyle modifications such as dieting, exercising, etc. Stage 2 hypertension, you would retake it after 5 minutes. If you can, retake it another time. And if it is still elevated, inform the patient of elevated blood pressure and refer the patient for urgent primary care provider assessment. And then you would delay the dental treatment, so you would just stop the dental treatment right there and then you would continue it once the hypertension is controlled. The next one I want to talk about is hypertensive crisis, which is basically, first you have stage 1, stage 2, and then you have a hypertensive crisis. So what is a hypertensive crisis? It is a hypertensive urgency or emergency. It is severely elevated blood pressure that can lead to a stroke. The systolic pressure is of 180 or higher, or diastolic pressure of 120 or higher. So signs and symptoms to look out for. So the patient could be, restless, very red cheeks, flushed face. They could have difficulty breathing. They could feel like they have a hammering type pulse, a lot of chest pain. You'll see them put their hand on their chest, and that will usually indicate something is wrong. So what is the emergency response? So the first thing you want to do is that you want to place your patient in an upright or a semi-reclined position. Next thing you want to do is tell someone in the dental team to notify the EMS. And then third thing you want to do is administer oxygen, either a nasal cannula or a bag mask, whichever one the office has on hand. And then the fourth thing you want to do is to monitor the vital signs. If at any time the patient becomes unresponsive, there's no normal breathing and no palpable pulse, you should immediately consider the diagnosis of cardiac arrest. That means the patient is obviously not getting better, the patient is getting worse, so you want to take action immediately. The third thing I want to go over is syncope. What is syncope? It is also known as fainting. It is the most common medical emergency in the dental chair. It is where there is a decreased blood flow to the brain and can be caused by lying flat or sitting upright in the dental chair for a long time, which is why it is the most common medical emergency in the dental chair. Many people are not used to lying flat or sitting, in the dental chair. Obviously, some people only do it once or twice a year. So, and it is also caused by emotional or physical stress. If someone has fear of the dentist, or they know that they're about to have, a cavity failed, or they're about to have a deep cleaning or needles, etc., they can come in very stressed out. Or there's other causes that may be going on outside of the dental office. So that's something we need to look out for too. So there's a stage called pre-syncope where, if you see the patient, they're walking in, they might have a pale gray face, they may seem a little dizzy, a little weak, they may act a little, they may seem faint, have a little bit of nausea, they may even mention it and say, look, I'm very nervous, they may be trembling, fidgety, very fidgety, and have a profuse cold perspiration. Signs and symptoms during syncope. Patients, if you, just physically looking at them, you can see that they can have dilated pupils, once again, very weak, dizzy, nausea, they can have this profuse cold perspiration, and if you check their pulse, it may seem rapid, but then is all of a sudden very slow. The patient may have shallow breathing, they can't really breathe, they're almost seems like they're freaking out. There is all of a sudden a sudden drop in blood pressure, and they may even have a loss of consciousness. And sometimes they may have a dead appearance in the chair, where you're just talking to them and all of a sudden they just kind of go, it almost seems like they go to sleep or have this dead appearance to them. So what is the procedure? So first thing you want to do is that you want to place the chair into Trendelenburg position. And I have trouble saying that, but what you want to do is that you want to set the patient where their feet are higher than their head. So you want to lay them all the way back. Next thing you want to do is you want to loosen any tight collars or belts so you can open up their airway so they can get some O2 circulating. Third thing you want to do is you want to place a cold, damp towel on their forehead, and then you want to crush an ammonia vaporol, which is what some people call like smelling salts, and place it under the patient's nose. Then you want to go ahead and get someone to monitor the vital signs, check the blood pressure, check their breathing rate, make sure everything's doing good. You want to make sure that they're getting better and not getting worse. You want to keep that airway open and continue to, once again, you're going to use that nasal cannula or a bag mask so you can keep that O2 flowing in them. You're going to keep the patient in supine position for 10 minutes after they recover to prevent any nausea or dizziness. So you don't want them to get up right away. You don't want them to go back into syncope. You want to prevent them from going back and help them get better. And if vital signs at any moment, if they start to go below the baseline, if they start to go down, blood pressure keeps going down, their pulse rate's going down, then an EMS should be contacted as soon as possible. And the last thing I want to talk about is angina pectoris, which is also known as stable angina. It is a type of chest pain caused by coronary disease, which is reduced blood flow to the heart, and a patient is more at risk when the heart muscle itself needs more blood than it is getting for example, during times of physical activity or strong emotions. So what are some signs and symptoms? So there could be a sudden crushing, paroxysmal pain in the substernal area, basically saying it's your chest. As you can see in the picture, there is this just tight pain in the chest, and this pain can radiate to the shoulders, the neck, and the arms. The patient may feel very faint. There's also all of a sudden some shallow breathing, and they may have, you look at them and they're going to have this look of fear and anxiety because they don't know what's going on. So the emergency response to this is to position the patient into an upright position where they are able to sit up and they are comfortable to breathe, and just a relaxed position. Next thing you want to do is you want to administer nitroglycerin to the patient. And this is something that if you can communicate with the patient, or if you knew beforehand that the patient has this on them, then you could reach into their bag and grab it. But if you don't know, obviously it's not the time to ask them if they have it or not. And so you should find out where it's at, grab it, and administer it to the patient as the instructions included, or as the instructions state on the medication. So then after that, you would administer oxygen once again through the nasal cannula or bag mask, whichever one is available. You just want to keep that air, the O2 flowing in them and keep them, help them recover. If there is no prompt relief from the nitroglycerin or chest pains, or if the chest pains last more than 10 minutes, then it must be assumed to be due to unstable angina or a myocardial infarction. And so, if the patient does not feel any better, if the patient's feeling worse, the pain is not going away, what you have to do is you have to treat it now as it states, an unstable angina or myocardial infarction, and call the EMS right away so then they can help the patient. And that is it. Thank you.